guys are all set. Thank you.
Okay, thank you. Okay, good evening and welcome to the regular meeting of the Orange Board of Finance. Today is Monday, February 28th. We'll call the meeting to order at 7:08 and start by having everyone introduce themselves.
Kevin Moffett.
Kevin McNabola.
John Cifarelli, Finance Director.
Jim Leahy.
Ajit Jain.
Kevin Houlihan, thank you. Item number 3, public dialogue. We don't have anyone here from the public, so we'll get right to item number 4, Orange Visiting Nurses Financial Presentation. Lisa, or Anna, or whoever wants to come
Come on up.
Everybody come
Don't
up.
go
or-
sitting out there. I mean, if we get questions, there's no sense, right?
Is it okay? Over ahead.
Yeah.
Thank you.
Yeah. Let's see, we have this, Lisa, you'll be doing a lot of the talking, I guess, but you can share the mic. You want?
Take it over there.
Okay, good.
And we'll go on.
Yes, that would be great. Pass them, let's see, what is it? Oh, couple over there for Kevin and Kevin.
Thank you.
And John, you'll need one, right? Don't one for Deb, because she's the recording secretary.
Thank you.
And I'll take one, and I'll leave, if you have an extra, I'll take one for Joe.
Yeah, I think I brought 8, which I thought was
Okay,
gonna be.
no, I'll make a copy, we'll get it to him.
Okay.
We have the electronic one now too, so that kind of helps.
Okay, good
welcome.
evening.
Good evening.
So we actually had a conversation with Jim on the phone, and he has developed the Medicare yearly report. So I would like to turn it over to Jim so he can review the numbers with you.
Good evening. I'm Jim McPherson. I'm from Peach and McPherson. We're a CPA firm from North Haven, Connecticut, and yes. Thank you. Sorry. So we were here in September of 2021, and we presented some information for the years 2017 through 2020. And at that time, we did not have the 2021 cost report completed. So we wanted to come back to present the results of the 2021 cost report. So the agency's year end is June 30th. So what we've added to the schedule this time around is the 2021 year, which is reported all the way to the right. The concern that you may recall we had back in September when we presented the 2020 numbers was that we were realizing a loss. The agency was realizing a loss that was fairly sizable, and we didn't know if it was attributed to COVID or the new methodology of reimbursement that we are under from Medicare. So
And you articulated that very well in your presentation that we see up on the screen here at that time.
good,
Okay,
yes.
Yeah.
So we thought another year would tell us maybe where we stand with some of that. So if maybe we can put on the screen the page 1
Yep.
of our,
Here we
there
go.
it is. Okay, so if we look all the way to the right, you can see the 2021 column listed.
Right.
And we have a total revenue of $996,901. So revenue is held fairly steady from 2020 to 2021. And then we have a section called expenses, total expenses of $1,836,608. If you see that total.
Right.
Okay, then from those expenses, we back out the cost of the school program because that is a separate program that has no revenue associated with it. That is a town-required program that's overseen by the VNA. So we have net cost excluding schools of $1,290,873. We compare that to the total revenue, and it shows there that we had a net loss of $293,972. And so we felt that was a fairly sizable improvement from the year before if we compare to the 427,222 on the same line. Of course, we did have CARES Act funding in 2020 of $54,931 that resulted in an overall net loss of $372,291.
We're going to ask questions as we go, Jim, is that
That's
good?
fine.
Okay, let's take a peek at what you just described. As we can see, because we just added some numbers there in the column for, you know, an increase or decrease, right? Or change, I guess maybe that's the best way to put it.
Sure.
Your change in revenue went down, it looks like about 21,000, right?
That's correct.
Maybe I should have subtracted it differently, but it looks like it went down 21,000. And then, but your expenses went down 130,
Correct.
which is good news, right? I noticed that a bulk of that happens in one category, taxes and benefits, 80,000. So could you elaborate a little bit on what's hidden underneath the taxes and benefits from one year to the next that resulted in that $80,000 better category?
I think possibly part of that has to do with the 2020 column, might have been a little bit inflated in the benefit category. Because if you look at the percentage across the board from 17 to 21,
Right.
it's pretty much been around 20 to 23% and jumped to 26%.
26, I see that,
So I think those numbers might have been a little overstated in 2020. These numbers do come from the town.
Right.
But obviously, taxes and benefits were at 24%
Right.
of salaries in 2021, and salaries did drop as
Right.
well.
Right.
So I don't believe anything is different. In other words, there's the same category of expenses in 2021. We're just happy to see those drop.
What drives the cost, if I can just continue, the net cost excluding schools? So something from this sheet, it looks almost like magic, right? Because the numbers aren't there. So just tell us what happened compared to 20 or even I don't know where, 19 or, yeah, when you go back, when you have net profit or loss of the income, this bold line here, right?
Yes.
So when we go back, there's the actual less, revenue less expenses always had 500,000, give or take, over 5 years. You see that?
I don't follow you there.
Okay, right here. It seems like this line here is 522, this line's 467, okay, not 500, but not close, 489, 529, 545.
Oh, okay.
You see, so
That's
I'm getting a consistent number there, but
Yes.
all of a sudden, I'm seeing from last year, maybe you help us from 17 to 21, what happens between that 522 or that whole line?
I understand. Okay.
Now getting down to net profits loss before other income kind of stuff.
Well-
Let's educate us a bit.
Okay, so we always back out the school program because, as I mentioned, there's no revenue to associate with the school program. But the school program continued to grow, obviously. Okay, that's the cost of the school program. So in 2017, the cost of the school program was $522,764. That's inclusive of all direct costs and overhead costs assigned to it. And that has grown to $545,735 by 2021. So the school program continued to grow. The home care program shrunk, as you can see. Okay, so the remaining.
So the school care program is like a fixed cost that doesn't have anything connected to what's happening to revenue?
Correct. It's all the demand of the schools.
It's all the schools.
Yeah, can you-
It's all the nurses in each of the schools. You have 4 schools, you have 4 nurses, you have part-time nurses when nurses are on vacation, out sick. I also believe that there was one year where the not foundation school, Hope Academy, didn't use their nurse. They used to have a part-time nurse, and they backed off from that. I think you've brought it
That's
back
correct,
now,
yeah.
right? Or
Right.
part-time. I think they want to come back full-time now. So that's another cost to the town mandated by the state.
And it's all under our budget, so we need to take that out before we report it to Medicare.
Right. And I think what you'll see at the end of this year, June 30th this year, you're going to see that school program go up even more because they were working without a contract, and they've got some substantial raises in the current year.
Was there a nurse also at the Hebrew school on Route 34?
Yes.
That's what I thought.
Yes, there is. Part-time, yeah, she's there about 25 hours a week. Yeah,
I thought we covered them too, so.
right, yeah.
And we were discussing this when we went through this chart back, and I apologize for Ajit and Kevin, who were not here, okay? But we were going through this sheet as one of the sheets in your PDF file last September, if I remember right?
Yeah, and you can see that the school program number there after allocation of administrative costs ties out to the 2020 column.
Oh, I believe it would.
Yeah,
I mean,
obviously
but I
it would.
would check if I were,
So-
doing a deep analysis, yeah.
So this basically looks like you have a revenue problem based on the total Medicare visits performed have dropped off by close to 50%.
Well, we do have
From 17
we do
now.
have a revenue problem, and that's what we talked about last time we were here, and that's
Yeah.
why we thought revenue was going to hold steady. And I didn't expect to have such positive results in comparison to last time around this quickly. But obviously, the expenses were cut.
Yeah.
And that's what you have to do when you don't have as much volume.
Right.
You know, it takes a while to cut your labor force and for that to catch up. But for that to happen in 1 year, I thought was really remarkable, and the trend is now going the other way. We were going to present a 5 or 6 month cost report because I didn't think the results were going to be here for another COVID year that quickly.
Yeah.
But I really think it's remarkable that they've turned things around and moved in the right direction since 2020. Because, of course, the 2021 fiscal year started July of 2020.
Right.
And, you know, we're still in the thick of COVID.
Yeah, tell me when you say 2021, when's the end of your 2021?
Okay, it's June 30th, 2021.
Okay, all right.
And that fiscal year started July 1 of 2020.
Okay, so let's just.
So I
get
got that
up
in
there.
it's in the heading.
Okay, so what we have here, I don't know what's happening here, looks like it doesn't like that. You have had a reduction in your loss of 133,000, right?
Right.
Which is a certain percentage of what you had, right?
Yeah.
Okay, so it's 31% reduction, which I think you said surprised you.
It did surprise me because I didn't think things could turn around that quickly. Although when we were here in September, I remember Anna saying, we've cut expenses, and I think that's true, absolutely. But I did want to also talk about healthcare and home care in general and the VNAs and the way that operates. Very few VNAs, if any, make a bottom line, are in the black in their bottom line operationally. The only way they generate profits is by bequests, investment income, or fundraising, okay? So obviously, Orange VNA does not have that opportunity.
Well, what happened in 17 and 18 then, because clearly they were profitable?
Yes, okay, and that was because we were under that different Medicare reimbursement system that offered us an opportunity to make more money under the Medicare program, which covered the losses in the other payers' sources. But that has changed, and obviously, expenses continue to go up. So that change in revenue is what we were concerned about last September, but we couldn't identify it or pinpoint it exactly to that because of COVID. COVID added another, intangible that we couldn't determine the impact. So I think you can see that, if you think about fiscal year June 30th, 2020, COVID really hit in March of 2020. April, May, and June, that was the last quarter of that fiscal year. COVID had a dramatic effect on operations, efficiencies, et cetera. And so I'd say that they rebounded fairly well after that awful quarter. I think any business you talk to had a terrible April through June of 2020.
Yeah, but your loss, your net loss for 2020 was 372,000. So even before the last quarter, you were trending in the wrong direction, it would seem, right?
Well, operationally, our loss was 427,222 because we got CARES Act
Yeah,
money.
okay.
So I'm just comparing the 427 loss
Yeah,
to the 294.
293. Yeah, okay.
Yeah. So are there any questions? I also added to the bottom of this schedule here that we do include non-VNA budget expenditures. For instance, the Clark Building where they're located, we have $20,000 of expense that we include in the cost report that is really town costs. But they occupy that building. We're required to include all costs on the cost report when we submit it to Medicare because they want to know the true cost of providing service.
So that's in the other, in
That-
the expenses, 3 expense subcategories?
It's in the other, the
Yep, it's in the
code A
178.
there. It's in the 178.
So that's really a phantom,
In other words,
It's
a
not a
cost you
cash.
have, right, it's a cost you have anyway.
right?
It's like oil for the building.
Yeah.
That building's very expensive to heat in the
It's
winter.
gonna get a lot more expensive,
The utilities were very high, I was
unfortunately.
surprised. Yep.
Before you go, just for the benefit of, we have 2 new people that were not here in
Oh,
September,
okay.
Kevin and Ajit.
I'm sorry.
I will send you some materials that I've tacked in here.
Okay, great.
And a little later, I'll show you where I've been putting materials up on our common website in Town Hall. I've been kind of transferring the materials I have in my PC up in there, but till then, my next step is to get you guys the same stuff we looked at. Because there's a very, and I'll just spike this out, there's a very educational 2-pager, I think it was, that Jim put together that helped understand how what he saw at that moment in time.
Right.
All right, so,
What do we, since 6 months has gone by, or more than that, of the new fiscal year, how's that trending, or we don't know yet?
We don't know yet. I haven't looked at any numbers since June 30th. We're required to do an annual cost report. That's what we're engaged to do by contract. Orange VNA, every VNA has to submit a cost report to Medicare if they want to be a Medicare provider and be paid by Medicare. So that's part of their regulatory requirement that gets submitted by November 30th of each year for the previous fiscal year. So we're engaged to do that. We're not Orange VNA's accountants or auditors. These are not audited numbers. These are compiled numbers from the town. Statistics are compiled from the agency. So I have not looked at anything since June 30th.
So are we going to run into losses in the near future, or there are chances of any turnaround?
Well, as I mentioned, in this industry right now, in the healthcare, the way the reimbursement is structured, it's pretty much impossible to generate a profit, okay? But you want to minimize your losses, and that's, I think, what we're trying to do here. So I would expect, you can see that the revenue is really held flat for 2020 and 2021. Luckily, we were able to reduce our expenditures to get the bottom line, have the bottom line be improved. How much more we can tweak those expenditures is questionable. You can only take them so far. And typically, with inflation and what we've seen, expenses are going to go up.
true.
So I'm not overly optimistic.
Okay, and I think you also told us that some towns that you had dealt with had OVNAs and decided to get out of the, I'll just call it the OVNA business, I don't know what else to call it, for
Yes.
this, to make it short and, direct. Has that trend continued?
Nothing different to report than what I reported in September, no.
Is there a way that anybody who's here tonight could help us with, are we thumb in the air since we are end of February, which would make us 7, that's 6, 8 months
in.
into this calendar year? Do we have an understanding of where we stand regarding revenue?
I could give you that, Jim. Now, these are unaudited,
Oh,
so.
everything's
there
unaudited, I'm
could be-
hearing.
There could be entries that have to go in, but at the current thing, through February, we've had $700,000 in cost, and we've only had 472, I think they posted some today, I'll say 500,000 in revenue so far for the year.
Okay.
So.
So if we had
we're-
5,000, 100,000 in revenue, let's just say among friends, would want to divide that by 8 and then times it by 12, right? So that would mean there would be our run rate is at 750. Does that feel right, John?
I don't think you could do that like that with the VNA. It's all based on their patients that they have. You could have 10 patients now, but a month from now you could have 30. It's not a, it's, I
not a
don't think
seasonal
you
thing,
could,
yeah.
right, right.
Well, it sounds like it also could go the other way then.
It could go either way. I mean, I would hope now with the COVID that the surgeries that people, the overnight, the one-day surgeries would start to pick up with the doctors and all, but you can't tell.
So which of these lines would be that second cost number that you described? Your guess at, estimate of 2022. What line? What would be the number? And the
700 right there,
right here.
right there.
Okay. All right. All right, 700. So that would mean that your run rate would be about a million, right? $1,050,000.
And the nurses wouldn't come into this because they're not in this report that I'm taking that number from.
Not including nurses?
Right.
You mean
You wouldn't,
expenses?
School nurses, yeah.
right,
Yeah.
you wouldn't take that out the way they're taken there because it's, Jim adds it to his report. We have different reports that
Right.
give it to him to combine it.
So how do we get down to, for an estimate of where this 470, 427, and 293 is, okay? Which
You're-
itself is not audited. How do we get down
According,
here?
it's right there. You're negative 200 by
Yeah.
those numbers.
Yeah.
So if this thing doesn't come into play?
Doesn't come
and-
into play.
Okay. So you're saying right now, we're negative 200. Oh, wait a minute, let me just change the numbers. We want to be able to just let Excel do all the hard math, right? So we'd just be subtracting this, right? And then we'd just copy that, right? And then we'd know where we stand. It sounds like it'll come up to 300.
293, 300, you're right there.
Okay. But unofficial,
If nothing
back of the
changes, but
envelope.
you could be picking up patients, like
Yeah.
John said.
Right.
People are starting to come out.
And-
I'm gonna have my
and-
first physical in 2 years.
Yeah, and then those,
And I'm afraid to find out what's
We don't
wrong with
want to
people.
know. We don't want to know, Kevin.
again, those
people
numbers
stay away
aren't
from
audited. There
They
could
didn't
be,
wanna see people.
there could be
Yeah, I hear you.
receivables out there that increase that number. There
No.
could be costs out there.
Roger that.
Increases that number or
It's-
decreases those
it's-
numbers.
it's-
So
it's got all
I
those
don't want you
variables.
to think those are
Hey,
hard and fast numbers.
He's not gonna take it to the bank.
Right.
No, I just want to have, we
Right.
should be able to say something more than we don't know.
Yeah.
That's all I'm saying. Okay. So we have another sheet even to look at though, huh?
Well, we do, but it's pretty much statistical information at the top of the page anyway. There's some revenue information at the bottom. It does show that we did a little better on the Medicare program, but it's only 3%, the bottom percentage. That was really just informational, that additional page.
Well, why don't you walk us through, since we do have two new people and we eventually might be voting on stuff, why don't you kind of walk us
Okay,
through
sure.
what we see here? Because it will educate us and frankly, will remind me what we're doing here.
Okay. So the first line is total Medicare patients served for that fiscal year. So for 2017, we were servicing 169 Medicare patients. But that's dropped to 106 for 2021.
Right.
So from 2020 to 2021, we went from 122 to 106.
So that would be a good reflection, Jim and team, as to why this number of revenue
Yes.
has gone down from over 1 million to whatever, 703?
Yes, absolutely.
Okay. The ratio sounds about right, the same, even a little more favorable, actually.
And then we have Medicare episodes. So Medicare episodes are the length of time that the patient stays on service, and you bill Medicare by the episode. But of course, the episode period has changed from 60 days to 30 days, so it's a little different. So we're still at 276. We were at 282, but again, part of that is because we're
So if I had a 58-day thing, I would have been 1 episode in the past, now I'm 2 episodes?
Correct.
So
Yeah.
while our number of patients went down, the episode
Stay the
can
same.
stay up.
That's
But
right.
it's the same service. Am I thinking right?
yes.
Okay.
And then our statistics for the number of visits that we perform. So typically you bill on a per visit basis, not with Medicare, but for non-Medicare, you bill on a per visit basis. So since our patients went down, the number of visits that we provided went down to 3,391. Now, if we can reduce our Medicare visits per patient, that's actually profitable for us, more profitable, because we're getting paid on an episodic basis, not on a per visit basis. So if we can get paid for the full episode and do less visits, it's more profitable because we don't spend as much labor
Oh,
to do
because
that.
here's where it faked me out, Jim. I immediately said, oh, 3391, compare it to 6144, that's 55% of what it used to be. And so my brain was going back and saying, maybe that's why it went down. But you're saying, no, it doesn't work that way.
No, it doesn't.
Okay.
One would think, yeah.
You would think it would, but it doesn't.
No, it doesn't.
Average net
God bless.
average net Medicare payment per episode, again, it's at $2,283, which is the lowest amount on that line, but that's again because it's a 30-day episode versus a 60-day episode.
Oh, I would have had the same idea there. It went down 35%, right?
Yeah.
And I was saying, 35%, that sounds like 700 to 1025, but you're saying, no, don't. go
Doesn't
there.
work that way. And it started, the new reimbursement system started January 1, 2020,
Yeah.
which was the midpoint of the fiscal year 2020 fiscal year.
Okay.
Okay, then we go down to revenue. We just talk about the gross Medicare revenue, but we have to back out the vaccine piece that we're able to bill Medicare for flu vaccines, and we get the Medicare PPS or the PDGM revenue for the year. Medicare sequestration, Medicare was withholding 2% of their payments, but when COVID hit, they said, we're going to give you the 2%, so that's why it's a dash or a zero in 2021, and that's why it's only about half the number in 2020 because it went into play January 1 of 2020.
Okay.
We matched that up to our Medicare cost, and you can see the Medicare cost was determined to be $613,854. So we have a profit on the Medicare program of $16,167.
Is there any stuff on this page that ties exactly back to what's on the prior page?
No, because this is Medicare only, and this is total. On the first page is basically total.
Okay, but no line item?
Well, the 703, it doesn't tie specifically because one is town numbers and the other is Medicare process claims.
That's
So
kind
they'll
of
never-
grenade close, right?
It's pretty close. Yeah.
Okay. So what's this saying to us?
Well, when I saw it, immediately I said that COVID did impact us in 2020. And now that we're coming out of it, I think we're more efficient. We're not incurring the costs we were. We talked about salary costs, and I talked about that, where if you have a nurse that got COVID, they can no longer work. They have to stay home. You have to replace that nurse. So you could have salary costs double for a period of 2 weeks or whatever, and they're both going to be assigned to the budget of the VNA. Correct, John?
Yeah.
So those costs are going to be in there double for that period of time. I'm sure we had some of that in 2021 as well.
Oh, had to.
Had to.
Yeah, we did, yeah.
So I really feel like, in 2020, we had a combination of the revenue issue. Obviously, revenue's down, but we did lose revenue in that April, May, and June quarter, I'm sure. And then in 2021, our revenue held flat, but our expenses improved. And the bottom line, I thought it was, I was very happy to see how far it moved in a positive direction. Obviously, we're still negative overall, but it's moving in the right direction. When I was here in September, we talked about doing a five or 6 month cost report to capture the period July 1, 2021 through December 31,
Right.
2021. My concern was that we weren't going to see the immediate results in the 2021 column. I just felt it was too soon. So we decided not to do that 6-month period because 6 months is really not a good period of time to match up to calendar years or fiscal years. So because the numbers were as good as they were in 2021, we decided to forego that at this point in time. Plus, it's costly. It takes a lot of manpower to do that.
Yeah, they spoke to me about it, and I agreed with them that it wasn't going to be worth doing at this time.
Well, it's a preemptive, rather than us asking that question, I appreciate it.
Yes, that's why I offered it.
So,
I think the bottom line here is you're never going to see the V&A return money the way it did years ago when
Right.
most of us were here. It's going to be pretty much, and Jim or Lisa, if you disagree with me, it's going to be pretty much a break-even thing if you watch it closely. If you don't watch it closely, it's probably going to lose quite a bit of money. It's just not something a lot of towns or cities are doing anymore. It seems to be like,
so Jim, to your knowledge, you work with other towns that have V&As, yes?
Yes.
Which ones do you work with?
That are town-based agencies.
Or maybe you're going to educate me, I don't know.
Well, there are V&As that are separate entities that are
Oh,
not
okay.
part of the town.
Oh, okay.
But municipal agencies, the only other one that I currently work with is Berlin V&A, and I think I mentioned that back in September. I did work with Naugatuck V&A, but they actually terminated services, I think rolled into another V&A, and there's only maybe 5 or 6 across the state. Old Saybrook, I think, has one, and very few.
Okay.
But, it's a luxury to have your own V&A in town. And, I'd be curious to hear what the townspeople had to say about their feelings about the V&A. They probably feel very lucky to have the V&A right in town. They have something, an issue, they can call them, or they can even show up on their doorstep, and they're not going to be turned away. Where these other V&As that are operating more like proprietary agencies, they turn people away.
How does turn people away hit the skids? Give me an example. Anyone, go ahead.
Okay, so, let me just turn this. So we get people that come in who say, my blood pressure has been, I think my blood pressure has been elevated. They have headaches, the sight isn't the same as it used to, that has changes. So they know that they may be getting sicker and need to see a physician. So we will check their blood pressure. Sometimes they'll come in a couple times a week, sometimes 3. Some people now have had their medications adjusted by the physician, and they come in once a week. So we actually have office patients that really aren't billed through Medicare because they're not homebound. They don't have the qualifications for home care, but we still take care of them. There's Orange residents that need an injection once a week. They come in, there's nobody available, they can't do it themselves, and there's no one available to do that, so we give the injection.
Can't go to a doctor to do that, or what?
I don't think they want to go to a doctor to do that. It's more costly to them to go to a doctor than it would be to go to us. We charge very minimal costs to the Orange residents when they have an issue and we can't take care of them under their Medicare insurance, under home care.
Okay.
So we have, I think right now, Anna, 5 office patients that come in.
So we're talking, for example, 106, now these are just Medicare, I don't know if you're talking Medicare or not.
No, I'm
No,
not.
they're not Medicare.
No.
Okay,
Medicare would not pay for that.
okay, so when you say Medicare patients, you're defining a Medicare patient as someone that Medicare is going to pay. I could be a Medicare patient one day and then same person walks in.
You have to be homebound
You
to
have
be a
to be-
Medicare patient. So you have to be
And there needs to be a
homebound. You
skilled need too.
can't physically be able to leave your home.
Oh, is that, so you have to go out there?
That's right.
Yes.
So we're talking about elderly population pretty much, where I'm headed, by the way. Everybody's headed there. I'm on the cusp.
Yeah, so these are patients that don't qualify for home care but still have a need. We get numerous phone calls from Orange. A lot of times it's family members who they'll say to us, this is what's going on, I need help, what do I do? And I will literally walk them through the steps. Do this, contact your physician, call long-term insurance companies, and I kind of help them along to try to get the assistance that they could possibly get. Other agencies aren't going to spend the time on the phone to do that.
Jim, Dr. Mohammed has any association with VNA?
Dr. Muhammad, is he connected to you guys?
He's our director.
Operationally, is there any
No, operationally, he doesn't really get involved, no.
policies?
No, pretty much our quality assurance nurse and the supervisors are the ones that develop policies.
Okay, he's not connected to your P&L in any way?
He is on the salary side, but it's very small. And he's just, it's a regulation that we have a director of health
Okay.
on our agency.
That's for the
He might need your microphone. Thank you.
It's a regulation, Medicare regulation, that we have a director of health, and that's why we have Dr. Mohammed designated as the director of health. But as you can see, his salary, I'm sorry, I apologize, it's not listed for you guys, but his salary is very minimal. It's about $2,500 a year, fiscal year. So it's just for him to put his name on the agency.
Okay, very good. All right, so operationally, pretty much standalone. You service homebound patients. There's a lot of benefits, it sounds like. Does it feel like when Naugatuck went off of having a VNA, they must have had to, it would have been the same situation in their town, right?
Well, the only thing, they were not in charge of the school program, so that's a huge factor here. You need, as a town, you need to have someone oversee. There has to be oversight in the school program by a nurse, by an administrator. And so,
If we didn't have a VNA in the town, the nurse program in the schools would be overseen by the school administration, like most towns.
Say that again, John?
If we didn't have a VNA in the town that oversees the nurse program at the school nurses would then be overseen by the schools, the administration in the schools, and that money would then be in their budget, not in the town's budget.
Those costs.
Board of Ed budget.
Board of Ed budget. yeah.
Right.
And the ballpark number of those costs would be,
$500,000.
Yeah, it's right there, yeah.
so, that one there,
No.
the school.
Skilled nursing, yeah, right.
Whoops.
Skilled nursing is us. It's the school program
The
where
school
we're
program.
minusing out, nope, the other page you're on.
The Excel one?
Yeah,
Sorry.
the
545.
545, 735.
There you go.
Okay, so that should get some kind of color of different from the other ones, I suspect. All right, guys? So we would call this, if there was no Orange VNA, that or a large part of that, John, would have to
That
be
whole
in the
part would go-
OB&E budget.
Go to the school board.
That does include administrative and general costs, so the direct cost would be less, a little bit less,
What percent, you think? Ballpark, over a beer.
30%.
30% less if shifted to
BOE.
OBOE, but that would be a big number. I mean, we could
Yeah.
see it's 300,000 plus, right?
Yeah, yeah.
Right. 10% would be, okay.
And
Good.
how are we taking care of the Amity? So this doesn't include Amity, 545.
No,
No.
this was, this
Just,
is a town,
Orange.
right,
Yeah, the
OBA,
town.
right?
Just the
So-
Orange Elementary
tell you that.
schools are in there. Peck Place, Racebrook School,
Racebrook,
Turkey
and,
Hill, and Mariel. And then a little, right, yeah, and then there's a small amount that's for the private schools that we talked about earlier, Hope Academy and Hebrew Day.
Okay. So in summary then, we went from 427 in 19. Let me just do something here. Breeze panel maybe
Hope
help.
Academy and the Hebrew Day School, do they pay for that, or we have to provide it from the state, right?
Yeah.
It's mandated.
Yeah, it's
okay.
mandated,
So-
correct.
The current nursing budget in our town budget is 300,000.
Now, how is
You
that
have to-
nursing budget?
And you have to take out the 10% for Anna and Lisa, that's $10,000. Yeah, so it's about 300,000.
What am I doing when I go to see that nurse versus what you just described a minute ago to help me understand what you do?
It's completely different. The school nurses are at the schools.
Oh, that's a school nurse
It's a
one.
school, those are school
Yes.
nurses, right. Our nurses actually go out to patients' homes and do skilled visits in their homes. They check their medication lists, they check their, like Lisa was saying, their blood pressure, all of their vitals, all of those things. Whatever the doctor directs us to do, because we're under a doctor's plan of care. So we follow what the doctor asks us to do when we're in the patient's home. It's not only nurses, it can be physical therapists, occupational therapists, home health aides, et cetera, different skills, go into the patient's home and they treat the patient however the doctor asks us to. Okay?
Okay.
All right? So I think I'm just giving you a summary because I think you've forgotten a little bit of how the whole thing works from the first time we were here.
Oh, only about 90%.
Yeah, yeah, it just seems that way.
I know where the file is in my filing system.
So with, we have all different payers. We have, as you can see, Jim listed Medicare and then he listed other.
Yep.
Under the other is all of your private insurance companies. It's United Healthcare, Aetna, Anthem, Connecticut. Actually, we no longer have, but Yale Health Plan. We have people that we are companies we are contracted with. Okay, and they pay us very differently than Medicare pays us. Okay. Those private insurances pay us on a per visit basis. They pay us, we're contracted with them and their contracts do not change. They pay us a very low rate. A reimbursement rate is very low. It basically does not cover the cost of us sending out a nurse or sending out a PT or anyone. So we basically lose money every year on those patients that are in that other category, okay? So what Jim is explaining is that we have to make money on the Medicare program because you're not paid per visit where you're losing money every time you send someone out. You're paid a chunk of money and you have to handle that episode appropriately where you're taking care of the patient as the doctor recommends or as the doctor orders you to, but also staying within the costs and trying to make money at the same time. So it's a balancing act, really. Okay, you can't do too many visits because then you'll obviously go over costs. You can't not do enough visits because then you won't take care of your patient properly.
Right.
Does this make sense?
Yep.
Okay. All right.
No.
So, like Jim was saying, so we want more Medicare patients always. We always want traditional Medicare, not managed Medicare, which is what a lot of the Medicare-aged people are going towards, are those managed Medicare plans that are given out by private insurance companies. And we are not paid by episode. We're paid by visit. So, again, losing money every time we go out. Okay?
And our percentage of managed Medicare is much, much, much higher than it was a few years ago. And I think a lot of that has to do with the hype on the TV and the commercials that make it look like you get a lot of benefits, which you may get extra benefits, but they cut back in all the different areas, including home care. So that's the tough part right now, is we don't have as many traditional Medicares. So when we do get them, they have to be managed very, very carefully. I meet with the clinicians, every clinician once a week to discuss what goals haven't been met, what goals have been met, and discharge them as soon as we possibly can with having all the goals met that the doctor ordered us to accomplish.
Another large difference is the the payment design, like Jim had said, from PPS to PDGM. We talked about that last time we were
Right.
here too.
I remember
As of
that.
January 1st, 2020, which is also hard for us to show because we run on a fiscal year
Right.
and Medicare runs on the calendar year, they changed their payment scheme completely. So where we used to be paid basically on how much therapy you provide to your patients, PT, OT, ST, we are now on a totally different payment scale where they pay you a certain amount of money per diagnosis, per functional score, which comes from an assessment that the nurses do on start of care. Whether it's an institutional or a community referral, which means whether the referral to your agency came from a hospital or it came from a doctor's office. Those three things drive your payment, okay? So where you used to be able to do a lot of therapy, make more money,
Yep.
you now can't do that. You basically are given a certain amount of money per diagnosis, per community or institutional admission, and your functional score, and you can't really go outside of that amount of money.
Where would you prefer to have the referral come from?
The hospital is much more, you get more money from an institutional admission. So it's
As
a
opposed
hospital,
to-
as opposed to a doctor's referral. So if you go into your doctor's office and your doctor says, oh, you broke your leg 3 months ago, but you're still not healing well and you're not getting out of the house, so we're gonna give you home PT.
Yeah.
And they refer you to us.
Okay.
We're not gonna make as much money as if when you just got out of the hospital from that broken leg
Yeah.
and the doctor referred you directly to the OVNA.
Oh.
We're going to make way less money right off the bat.
Do they ask you that question, these doctors? Do they say, do you want me to be referred?
No, the doctors have nothing to do. They don't care what the agency's making. They're just taking care of their patients.
I'm trying to get, who says the trigger, your OVNA will, you see what I'm saying?
When you are in the hospital, if they decide that you need home care,
Yep.
they are required to offer you at least three different agencies, right? And the patients can choose an agency from those, the three that are offered to them.
So if it looks at the thing and they see you're from Orange, and unlike most, there's an OVNA in Orange, will they
We hope.
100% tell you that one of the three choices?
Not necessarily. Yale, luckily, we're a preferred provider, so yes, they should
That's a
offer
good one.
us. But Yale also owns their own home care agencies now, so that's part of the problem as well.
Yep.
Yale has been, as everyone knows, been buying up hospitals and facilities all over Connecticut. So when they buy these home care agencies, they obviously drive referrals, and the good referrals, the Medicare referrals, the ones that make a lot of money, to their own agencies.
I'm sitting here thinking, since this can drive revenue for you, how about an article, when you should request OVNA?
Yeah, absolutely. We have, I do agree an article would probably help, yes. But we do advertisements where we put exactly that. Think OVNA or choose OVNA, because a lot of people who go into the hospital don't know that they have a choice sometimes. They're given an agency and they don't realize that one VNA is not the same as OVNA. Like you said earlier, you chose the term OVNA.
Well, listen.
There's only one OVNA. Everything else is a VNA of
Listen,
somebody.
here's an idea for you, okay? There's a lot of benefits, it seems to me, to having an OVNA. Although someone else may make a decision, I don't make this decision.
Right.
But
I think you
just,
have some
you know.
input in the decision.
But if there's something simple that you can do, I mean, it isn't like the fire truck thing.
Oh, it's,
But-
yeah, sorry.
But sitting down, someone asks you some questions, writing it up. What do you do? Give me an example. What are the benefits of having OVNA? What would assist your situation?
Yeah.
I mean, you've already told me stuff in this room tonight. But, if I sat and took notes,
Right.
and spent the time writing an article,
No, I agree. I
know
think
what I
that
mean?
would probably boost some revenue. So that's under our advertising, obviously, and we talked about last time we were here increasing our marketing again, which we haven't over the past couple of years done very well at all. We do have a marketer who's full-time, 40 hours a week. But unfortunately, she's been designated more in-office duties than out outside marketing duties for a few reasons. Some of it is COVID related. We weren't allowed to go into facilities and actually actively market for patients in our service area because you were locked out due to COVID. Another part of it is that at Yale, say, the larger agencies are allowed an inside liaison, so they can actually walk into a patient's room and talk to the patient about their services because they're a larger agency. We're not allowed to have a liaison in Yale because of the size of our agency.
Look, an article you throw into, or ask Rocky if he'd be interested in printing something that's reasonably done, a couple pictures, all right? And you know, and you could even do, like I said, 4 or 5 questions, a couple pictures, get it in there. Then that becomes a reprint.
I think that's a
And
good
if people-
idea.
If you can't get into places, you can also always email it.
Yeah, no, I think that's a good idea. We service not only Orange, Woodbridge, West Haven, and Milford. So right now, we only advertise in the Orange newspaper. We were talking about doing an advertisement in the Woodbridge newspaper to hopefully get some more of our Woodbridge clients. We don't have too many out that way. We choose not to use the newspaper that's Orange and Milford for some budgeting and expense reasons that we had issues with the editor for a couple of years back. So we don't use the Orange Milford Times. But we advertise only in the Orange newspapers. And what else did we do? Last year we did a stand that was
CVS.
inside CVS. It was called a wellness center. If you go into
Yep.
CVS or you go into,
Down here.
and they have the sanitation wipes where you can wipe down your cart or wipe down your basket before you go shopping. So we had an advertisement in the Milford CVS hoping to get some more Milford clients. Didn't really see a return on that, though. We spent quite a bit of money on
Well,
that.
that's why I like articles and seeing it local.
Yeah,
Because
yeah.
look, you just told me you have 106 Medicare patients served.
Right.
You could bump that by 25%.
Yeah, we've
That's 25 people.
Our census has absolutely decreased, and you can see it started when COVID started, and we just have not gotten it back. It's been really, it's an overall census decrease. It's not just Medicare, it's an overall census
yeah.
decrease that started at the beginning of COVID and just has not returned. So, yeah, anything that we can do marketing-wise and any suggestions you have, we're absolutely open to them.
Why don't you guys, I gave you my email address. Please, why don't you
Yes.
send me a note, copy yourself on that, right? And I'm gonna come over and we're gonna talk.
Okay.
Okay.
It can't hurt, whatever else happens with this, right, guys?
That's it.
Yeah, no, I mean, the biggest thing is you need patients to
You need
make money.
patients.
Yeah, right, and it's very clear that when our census decreases, we don't make as much money. But our salaries stay the same, they actually increase. Everybody gets their cost of
I hear
living.
you. You need more people.
Right. We need
have
more
them in
patients.
Orange. We got an aging population.
You're
More
absolutely
awareness.
right.
All right?
Yeah, volume.
Come on.
You're absolutely right.
We'll leverage this
Yeah.
thing up.
Yeah.
We've done this before in other areas.
We appreciate that, thank you. Yeah,
So do that tomorrow and I'll call you.
okay, thank you.
Sounds good, thank you.
Anybody have any other questions? Thank you for coming.
Thanks,
I know,
guys.
Jim, you're probably as busy as I am, so this is probably the last thing you want to do.
Yeah. If you want another meeting next month, I don't think I can.
Yeah, no, I won't be here.
Thank you, everyone.
Thank you very much.
Okay, team, I'll send you this V2. I took some notes. I don't know if it's helpful to you. If it's not helpful to you, just toss it. Okay, but at least you saw it here, and even if it's wrong, it's what we said tonight. So that'll be a next step
I'm
for
going
me.
to look for a motion to have a 5-minute recess. Maybe Joe will arrive in the meantime from the Amity meeting since
Let me
he's
see if
next
he's
on the
got an
agenda.
email from him. I don't know.
Is there
Yeah, I got a motion, sure.
motion? Second. All those in favor?
Aye.
Aye. Okay.
Give me 15 more seconds.
All right, you're all set, thanks.
Thank you. Okay, we are back at 8:10. And, find my agenda here. Item number 5 is the Amity update, which we usually merge with 6 at the vice chairman's report. Since Joe's not here yet, Jim, it's all you.
Okay, I may have gotten a text back. Okay. We don't need to talk about that. He's still in the meeting.
Oh, they're still meeting up
They're
there.
still meeting and
Oh, that's,
horse trading apparently.
that's a good sign.
Okay, violation on me? Thank you. Okay, I put together a series of slides for tonight. Why don't I just go through them? Some of them are new, some are not. One of the things we have seen in the past is what happens on compound interest if you had 1% a year and 4% a year. The reason I've decided to remind ourselves of this now is that we have a proposed Amity budget at this moment, although they are meeting here tonight, and that's where Joe is right now, of a budget that would impact our town, our taxes, at 6.27% per year. And I wanted to graphically show what that is in comparison to the other two that we have seen in the past. I wrote an article, I think you may have seen it. People on OGAT may not have, and I'm just briefly summarizing it here. On the left-hand side, what you have is last meeting, or the meeting on January 24th, your Orange Board of Finance unanimously approved a motion to support an Amity budget of 0.41% increase. One of the reasons that we do this is, and talk about this, is last year in fiscal year 2021 to the current year 21-22, there's ways of looking at budgets that we need to be very, very clear about. And I think it's pretty easy if you think of your own home budget. If you increased your budget at home by 1.6%, 1.8%, it would only go up by a little bit, the green to the green. But if you didn't spend what you had budgeted the prior year, as is the case at Amity, you actually were going up from 47.7 to the 51.69 that you see there. And that's actually at 8.2%. This has been going on at Amity for quite a while, all right? And that's one of the reasons that the board, this board, your board, unanimously looked at the data, a lot of slides. It was on OGAT, it's now in the paper, all right, supported a 0.41% increase for Amity. In that article, and this is a summary of it, you can see that historically the average line is 2.35% for a budget increase at Amity over a sizable period, and this year's budget is significantly more than double that. More than double that, even though there are 68 fewer students, all right, the lowest number of students in 20 years at Amity, and 11 fewer from Orange. Despite the fact that Orange has 11 fewer, bullet point number 2, our share of Amity students goes up, all right, from what you see there, 49.9 to 50.36. In addition, there is a proposal in the budget to add staffing of 7.2 staff positions. The spending increase is about $2.5 million, which brings it up to $54 million, and you can see the number there. A 4.92% spending increase. Of this, 15% of the increase goes to the schools and 85% goes to pupil services and central administration. When Dr. Byers was here with Terry Loomis, the Director of Finance and Administration, they indicated the reasons for And some of the reasons, very good reasons, special ed considerations. But the reality is that that's what they have come to propose. The one-year impact to Orange, however, because of less money coming from the state, is actually 6.27%, $1,581,917. Not only that, the second last bullet, number 8 there, next year's forecast has a proposal in their document of having another 4.49% increase, budget to budget. Budget to budget means green to green. Okay? So that's what we got. And the 4-year budget forecast, the increase to Orange taxpayers from Amity is nearly a little under $3,800,735,681. That's material that was in the article. Other material in the article showed, and educated people, I think, more and more people are stopping me, asking me more details about it, that the average surplus in the last 4 years has been almost $3 million. And you can see historically, while it has been a surplus, as it should be, they shouldn't be right on the red line of survival zero, but $3 million. I believe there's a guy we all know who might use the words, come on, man. All right? I did a calculation, and I'd like it either in this meeting, Mr. Chairman, or soon thereafter. I did a 4-year impact of what Amity's surplus did in terms of raising taxes. So get out your pencils. I'll be happy to find out that I got it wrong, and you can improve it. I'm not unhappy about it. If we had $1 million, we have 50% of Amity, right? So $1.5 million out of the $3 million every year is overtaxed on our taxpayers. Agreed? Okay. If our budgets, and John, I kind of ballparked it at $72 million, all right, over the last 4 years. We can change the number. We can do it right on that slide if we come out of screen shell. $72 million was the total Orange budget. So to me, dividing the two out, 1.5 over 72, 2.1% was the percentage of the budget that wouldn't have been there if we took out that $1.5 million every year. Now, your average taxes, I put down 7,500. We can pick a number, again, sensitivity analysis. I put 7,500, the average taxes. I think that's about
It's
right.
a little low, but that's...
A little low, okay, thank you. We can do some what-ifs. If so, then you multiply the 7,500 by the 2%, 2.1%, and you got $156 yearly overtax due to the Amity surplus. And if you talk about the last 4 years, what's been the impact, you multiply by 4. All right, so I got $625. So this is a first cut analysis. If any of those numbers need to be juggled, we can juggle them. But I think that's the kind of structure to be able to quantify what this has meant. And I apologize if I should have been, if I was smart enough to be able to do it when I came up with found out the thing before, but frankly, I was doing it about an hour and a half ago, Jashit, but don't tell anybody.
So Jim, if you include compounding, it will be more than 625.
Correct. Correct.
Like for 156.25 compounded at 2.1% for 4 years.
Well, no, you have to compound it by what you could get elsewhere, and frankly, I don't think, unless you have some place to put it that you can guarantee. I think the best I could do is savings, and I think we need to put your mic on so that we can hear. Thank you. Anyway, this was not in the article. I apologize. I snuck it in there. What was in the article is this. I did a thought experiment. What if everybody, hey, 6.27% on taxpayers? Okay. What if the town did that? What if the Orange BOE did that? What if they followed Amity's lead? And all had a 6.27% impact. What would that, it says how, violation there. How would that impact you, the taxpayer? I guess I did get, there's your chart. And this was in the paper, right? Orangetown News. So depending upon your value of your property, you're right, multiply by the 70, and anyway, you get these numbers, right? The actual number I did was the average tax. I think I had Kevin's 355.5. That's one we've used in presentations in the past. So you're right, the current tax would be 82.74, so maybe something higher than 7,500 would be proper. But the idea is it's not a small number, all right? These are assumptions, what if everybody followed it? But the idea is, you know, it's like you have 3 children. You got Amity, you got the OBOE, and you've got the town. You got to treat them all kind of fairly, the same, right? But the number's large. That's the point. 519 if you're in the 355 range. If you're in the 500,000 range, you're at 730. I've done this chart, by the way, for Woodbridge. You wouldn't believe it, okay, what the numbers turn out to be. Their house values are more. Their mill rates, what, 42.4 now? Ours is 33.25. All right, so you can guess what those numbers on the right are. They're well over $1,000. So finally, I'm quoting here now, so everybody who didn't read or didn't see it, Mr. Houlihan, I asked, the continuing over budget at Amity filters down to our town departments and the Orange Board of Education. In essence, Amity is taking money that only results in surplus that could be deployed elsewhere or not taxed at all. Kevin, I believe you sent me, budgeting should be based on actuals because as seen by the Amity surpluses, the prior year's budget is inflated to begin with. And going back to Kevin, and I'll be happy to get Ajit and Kevin McNabola and Joe and other ones, the most important thing is that Amity has averaged almost a $3 million surplus in each of the last 4 years. That is the key to our 0.41% increase. Taxpayers need to know we are not gutting Amity. We're expecting Amity to budget for what they need and not continually over budget. So in the kicker box at the bottom of the page, and how I ended the article, as always, it's up to you, the taxpayer, to judge if the Amity budget request best serves the people of the district. You get to vote on that question May 3rd. All right? And they are thinking about what they want to do with this year's budget even tonight, right now. Okay. Here's the details, and I added on the bottom there, I don't know, Kev, you can see it, but this is in the budget book that we got. These were the proposed Amity budgets. You can see in the yellow, right, the 4.92% increase for next fiscal year, and there's the 4.49% increase right next to it, right? Right next to it, right there. I see it's not, my clicker doesn't go on the screen. And then they have less ones coming in the future. And that's where you can see the amount that it's going to impact at Orange over a 4-year period. That's where I got the 3,835,691. I didn't do the exact number, what will happen to the student ratios as we go forward. I just used a fixed number. And I did the same thing at 33% for Woodbridge, because they're at like 32.6 right now. And they got a number that's 2.5 million as well. Now, here's one that I think that's very telling, and I'm not sure what it's telling, but I'd ask you guys to give me your commentary. I went back over the last 5 years, by month, what the surpluses were, because I was starting to say to myself, wait a minute, how come, you know, we got good people at Amity, Board of Education, right? They got elected. What data are they looking at when they make the future year budget decisions? Like, what data are they looking at now, right? So I went back and I got the data, you know, punched it in, did that, and I said, oh, when you get to February, all right, you only have January's data through January debt, right? So now we don't have February's data yet, right? So they're making decisions about where the surplus is now. In some years, it's only at not a lot. So too, what data do we have when we're voting on the Amity budget? The data in the current fiscal year surplus when member town taxpayers vote on the budget. Well, we vote May 3rd. We don't have the April data yet. So the best we can do is look at where we stand at the end of March. And then this happens. So let's review the bidding. When elected officials are looking at a budget, they're seeing this from the current year. when the people are voting on the budget, they're seeing this. Even if they had the data, they might not even know the data, but their leaders do. And then this happens. That's our $3 million on average at the end of the year. Not once, not twice. All right? So there's some stuff on OBOE contracts. I showed you this for Amity. I'll show you this for, this is the contract with the, and I'll send you this presentation. All right? You can see what you get if you're a teacher. And over behind Kevin's shoulder there on the lower left of the slide, the average teacher salary, this is in orange now, is $82,792, 118 staff, average. It doesn't count extra, duties. All right? You get 15 sick days, you get certain number of personal days, and that kind of thing. I could not find that much in the administrator's salary. By the way, this thing here was they have a new schedule going forward, all right, for orange teachers. This is the old schedule, but it does cover 21, 22. All right, I haven't been able to track down. I know it's in town hall here somewhere, John, all right? But here's what you have at administrators. That one's even cut off a bit by there. Sorry about that, team. I could do better. The average administrative salary for next year for Orange is $152,823. Kind of the same as Amity, a little bit less. 9.5 staff that has. And again, your 15 sick days, 4 personal days, 30 vacation days. I want to make sure everybody has this data. All right. So, and again, I showed you the Amity contracts. I think that I had this is last year's salary data, the Amity data over to the left there on the lower left of the slide in the yellow box. 81,190 and they teach 185 work days. So that's 37 weeks. All right. And again, there's the administrative salaries over at Amity. And again, all this is up online. And that's where John has sent it to us to be able to figure it out. Okay? And the only other thing I have, Kevin, is pass forward for when we get to that period. I can
All right.
show you. So if you guys want me to do any what-ifs right now on this, I would be happy to do it. For example, Kevin, what would you think would be the average taxes?
I think it's closer to 8,500.
All right, let's throw in 8,500, see what happens. Whoops, violation. So here's what you do. You say to yourself, you put it in today's folder, didn't you, Jim? And the answer would be yes. Orange. Oh, I know where it is. I put it in your file, John. I thought I had copied and put it in there so that I could do sensitivity right on the screen. It'd be $708, Kip. Any other, and I can send you this file as well, or put it into a separate thing. Does 72 million seem like the right number, John, for the last 4 years? Well, the adopted budget was 76 for this one, and I thought I had 17, 18, but I don't know if 68 is what we adopted. I could have gone back to my town budget. For me, it was grenade close, for now.
Works for me.
Okay, so there's the 2.1, so there's $700. So that's what's, that's real money, as Mom used to say, right?
Jim, can we look at your slide where you had that 0.41% from 47 to
Which one, Ajit?
the green, where you had that graph?
First slides.
Number 5.
Right there.
Number 5, thank you. Yes, sir.
So this year they are asking for 54.24, right?
Right.
So from 47.79 to 54 will be actually 15%.
Here's the problem. No, here's, good question, very good question. That's the actual in this budget year. We don't know yet, since we're not at the end of the year, what the actual is. In other words, what the actual expenditure is. Okay? Well, one of the things I said in the article, though, is they're asking for an increase from this $2.5 million. And if they had a $3 million increase, if a surplus, I don't think they will, then that would be a $5.5 million from
47 point.
yeah, where the 47 is now. That would be a 10% increase.
Right.
Right?
Yeah, I was.
Yeah, yeah, we're thinking the same way. Yeah, good.
Okay, item number 7. Discussion and approval of minutes from February 16th, 2022 special meeting. John?
Okay, first thing, Deb, on gas, let's add Bob Britton, town engineer. He was here for the whole.
Yeah, and he yelled out a few things too.
On page 2, right at the top there, Mr. Cifarelli advised that the Board of Selectmen in executive session, I would put discuss the purchase. They didn't approve it in that. And then where it starts, they later in open session voted to purchase this land. Just to clarify that.
Oh, yeah, that's an
Everybody
important,
out of trouble.
Yeah,
And then under old business number 1, tropical storm, Mr. Cifarelli advised that the town has not yet received any money from FEMA, any more money from FEMA, it should say.
Because we did get something way back when, right?
We will talk about it later.
yeah, we have it on the agenda.
And then under annual audit review, it should be sometime in March, which will be next week. And then on page 3, under number 4, Board of Health, Mr. Cifarelli reported that Dr. Mohammed held his first clinic today.
Why don't we put in parentheses what that day was?
Well, you got it on the minutes. If you wanted to.
Well, when you're reading it, I think it doesn't hurt.
Yeah.
If you want to keep it out, fine, but I think it
And
doesn't
that's
hurt.
all I had.
Okay. Kevin, I didn't have anything.
You didn't have anything, Jim?
No.
Anyone else? Is there a motion to approve the minutes as amended?
Make a motion to approve.
Motion by Kevin, second by Ajit. Any further discussion? All those in favor?
Aye.
Opposed, abstained, unanimous. Thank you. Item number 8, budget discussion.
I handed out everybody today, I did the revenue, so it gives us idea where the revenue is. That's keeping the mill rate at the 33.25. It's dropping the mill rate for the cars to 29, like they're proposing in Hartford.
John, just let me catch up. I'm sorry, I was checking from Joe. We have an update, verbal update from Joe. I can give it to you. Which one, John? The
The
mill,
revenue report
Re-
that I sent you today.
this one here? Thank
No,
you.
revenue report. Yeah.
Oh, sorry.
Well, you had it open.
No. I know where it is, John. I created a folder for it. Thank you.
Okay, so, as I said, it keeps the mill rate at 33.25 for real estate and personal property, drops the car tax mill rate to 29 as they're proposing in Hartford. I left any Amity refund at zero right now. I colored it in yellow. I did put in the 700,000 that the state proposes to make up the money for the car tax. In doing all that, that gets us within 250,000 of what our expense requests are. Before we do any cutting.
That's very good news.
That's what the Amity budget, of what they proposed to us in January, and it's what Dr. Scarpetti had given me as their proposed budget. But I do believe they are probably going down about 40,000 from what I show here when they propose next week. They're still working on it, fine tuning it this week.
Well, we can talk about sensitivity analysis and stuff. Let me understand what you've done, John. You've put in 0 for Amity. I know you said some of this verbally. I just want to make sure I'm tracking rather than, okay. Do you know what last year our adopted budget, this one was? In other words, 91.95. Do you know what that was last year?
Kevin, you got your book?
Yeah, I have a book.
Oh, so it's, okay, so it's L200, I see what you got, okay. So you're going over
tell you
revenue
in a
projection of the total. Okay. Okay,
Last year it was 91.07.
so it's a full, almost, it's 88 hundredths higher, almost 9/10 of a full percent higher. Let me just right through what I see here.
Yeah, property tax collections are strong. so.
Let
Last
me,
year, we had a. we
let me
had a-
hide these for a
We had a
second.
big drop in personal property
Yeah.
due to UI, and this year we have a big increase in personal property due to UI.
Due to UI.
Yes.
So
Okay, so,
my concern will be next year, we could have a double whammy though. We got reevaluation, whatever happens with them, and we have Southern Connecticut Gas moving out, which they're now our third largest taxpayer when I put out the,
On the personal property side too, they're
on
huge,
the,
right?
you know,
It's not just the real estate, we're gonna,
so you put
I think
the,
they're shifting a lot of their stuff to West Haven, right?
they're shifting, at least their, yeah, at least their vehicles are going to West Haven, but there's talk that their office personnel are moving into the UI building, and then
Oh, 'cause,
supposedly.
yeah, they're all owned by the same people now.
So, yeah, and supposedly they're gonna sell their office over there.
Well,
or it's-
I would think they would keep their vehicles registered here. Our mill rate's better.
Well,
It's gotta be cheaper. It's gotta be cheaper, not cheaper.
it's cheaper, but it's not legal.
Well, if they still have, they have facilities
Yeah,
here.
but it's supposed to be where they're garaged.
so John,
Well, that's Amazon, that's
No,
something else to work on.
they're actually starting to change over their vehicles. If you look, there's a lot more Connecticut
Yeah.
plates on them.
Yeah.
Yeah.
Well, that's good.
so we are going up 3 million in revenue for property tax and related revenues. Right?
Right.
3.2.
Okay.
We
So
haven't had
we
a
must
grand
be
list
going
like that.
down, way down somewhere here. So let's take a peek.
There's no 850 for Amity, and there's no use of fund balance.
Correct.
Right.
That's $1.5 million.
Roger that. Water company pilot at almost 100% down.
No.
Oh, no, I'm thinking wrong, guys. Apologize.
way.
Apologize, I'm thinking wrong. Thank you, Kevin. So you're accepting the
Well, that's gonna,
700?
that's gonna be for you guys to decide how you
No,
wanna handle
roger that,
What?
okay.
That
The,
sev-
motor
that
vehicle
motor vehicle
reimbursement.
stuff.
Right.
That's the one he kind of chicken scratched on the mill rate thing, right, Johnny? Yeah.
That number's right from the state, though.
Right.
Yeah.
But who knows, by the time we have to set our budget by March 31st, they're not gonna have their,
We're not gonna have it.
right.
But will they have passed that it's gonna be capped at 29 by then?
Or will they pass it at all? Who
Because if they
knows?
don't, then at least we could go back, we make it up on that end.
Right.
We're back to the 33, whatever we're at.
It'll be too late to change our budget by the time we know.
When was the last time? End of May, right?
Yeah, but my point is, if they don't, right now, this assumes we're capped at 29.
Right.
If they end up not doing that,
Right.
then we pick up another 4 mils on the vehicles, so we should be whole. What do you mean, no?
Because we'll already have done our budget by the time they decide not to do that. Our budget's gonna go to referendum in mid-May, third week in May. They probably won't have that done. When do they end their thing? June.
Early June. But I think what Kevin's saying is, if you build in the 700 on the mill rate.
Microphone, Kev.
If you build in the 700. If you build in the 700 on the mill rate on that separate line, and it doesn't happen, our number's still above where motor vehicle would be normally recorded is 700 lower, right? So
Right.
if they don't approve it, you're still gonna get it. That's what you're saying.
Right, we're gonna be able to invoice them at
Only-
33%.
Only if you hold to printing our tax bills. Usually the day after we go to referendum, those tax bills go to the printer.
Yeah, but tax bills,
Then
Yeah.
we'd have to do a supplemental one, which would anger people, but we wouldn't have a choice, I think, to send out an extra 4 mils on that if we don't.
well, actually, your tax bills aren't necessary, they don't really have to go out until June, right? When do you send them out?
July 1st.
July
she used
1st.
You
to-
do?
But they have to be printed before then because the whole state is just about.
Kevin,
Yeah,
I'm gonna
with
do
UBS.
you wanna do you know what the difference is between the two, the 29 and the 33.425, Kevin?
Nope.
I can run it. Let's just run it.
Well, it's roughly at 700.
Let's for right
Yeah,
here.
it's
It's roughly,
700.
it's the 700 number that the state gave us.
Yeah, roughly.
Yeah,
Well, let's do this. There it is, 33.25, right?
yeah.
So if I take this one, which is the result of 33.25, and subtract off it the one that was there, I think it's way different. It's 809.
Yeah, but that's because we do a lot of refunds through that account.
No, that's fine.
too.
I didn't know what the number was
There's
going
probably
to be.
$100,000 in refunds that go back to people for.
Okay, if you guys are
hard
good with it, I
taxes
just,
during
I
the
just
year.
did another tab here, guys, and put the, just change this to 33.25, that's all. But I'd like to go back to that other file, John, as I'm kind of scanning through it, because I had a way different. Okay, so I'll go up, you and Kevin were talking, and I had some questions, so I just highlighted the items. Okay. Various recycling reimbursement, we're projecting 0.
That number, the 20,000 moved into the 180, about 5 lines above.
Above? Okay, thank you.
There you go.
The two things over police, where we had numbers last time and we don't have them at all this year.
Yeah, I have, those aren't things we've been getting. I gotta talk to Art about that and check on those.
Yeah, because it looked like we've been
Look at the
getting them for a
actuals.
while,
Yeah,
right?
Then it tailed off.
Yeah, tailed off and came back. And I don't know what the actuals are, but, just, we're working as a team. We're just talking about it.
The DUI enforcement, that's when Gagney puts a cop on that state narcotics thing, and he gets reimbursed for that. So that's not really money coming in unless we spend it going out there.
Okay.
Then it washes.
So we are expecting Park and Rec, okay. We are expecting the same on ECS.
Yeah, that comes from the state.
Yep. 340, Public Health Nursing Net.
Yeah, he went up there. I'm not sure why he went up there.
It's
Okay.
based on the actual, probably. The prior year actual's 339, right?
So we're going up, down 484, on the non-revenue side.
Yep.
So essentially, it's the 6% of projection. And so that, plus the one way up above, this 93.33, which is the most of the tax-related stuff. Here we have the other mills. I just put some reminders for myself in here on what we've got here. See, because when we get to it, and I don't think we should go too deep tonight, Kevin, but what I did was I took what we had tentatively seen in that mill rate thing, and I said, wow, this is an opportunity here, right? Because if our grand list was going up what I thought it was going up by, and our expenses go not as much up, then our taxes shouldn't go up at all. So I started asking myself, if I was, not, just read the newspaper in Orange and somebody, some group named the Board of Finance set our tax rates, and I found out we had an increase in our grand list of 5%, I would think that should translate to something obviously significant as a return to a taxpayer. That's, common sense kind of part of my brain. I mean, tell me if I'm way off, I'll be good with hearing it. But that's what I was thinking, In other words, if revenue goes up 5 and taxes and spending goes up 2, there should be a reduction of 3, or thereabouts.
Yeah.
Now, $500,000 because of the Amity and the fund balance. You didn't put the fund balance in, John?
That's
okay.
Yeah.
That's
Yeah.
really a plug anyway.
We're not
right?
using that this year. We don't need to. That was a COVID plug. And that was when PJ made the motion that the Amity surplus would be used to offset the next year's taxes. That's why we did that 700 last year.
Well,
And hopefully we didn't need it all.
in a certain way, then putting it back in this year would make it a definite offset.
No, we don't want to pull any more money on a fund balance for that.
We're gonna need $1 million for paving, too. That's gotta come from.
So we have to
That-
look-
That's where the whole discussion comes, not tonight, but
Yeah, it
as
has
we
to
get
be
through
done
this,
tonight, yeah.
is if we're ahead, it'd be great to give everybody something back. Or we know we have other things to do, like paving. Does some of it come out of operating balance this year? Or I don't know. It's not my decision. It's everybody's to talk about, but there's things of that nature that, we could take care of.
So we have to look at the budget, the fund balance, the capital, right? I kind of see them all at the same time
Yes.
to be able to have a really meaningful,
Yeah.
going
And get
path
updated
forward
numbers from,
discussion.
whether there's updated numbers from Amity, updated numbers from the Orange Board of Ed on Monday night.
Yeah.
That are gonna be hopefully lower than what's in here, or in there. But at least,
I could easily get this down to, our expense down to what our revenue is showing right now. I think there's a difference of 250,000 in cost over revenue. I could very easily get that down to the
right, and then we're gonna plug in,
balance.
the Amity surplus is not gonna be 0. It's gonna be something else. So
Yeah.
we're gonna,
But that's not
we're
for
gonna be on
me
the
to
right
put
side
in
of
there,
it.
that's for
Right.
you guys.
Right,
to
right, but
decide.
This is probably the best news I've seen in 23 years.
I could never remember getting that high.
The grand list?
I thought it was wrong. When I was in Brent Casey's office,
Well, it was wrong one year, when you and I had
don't remind me, it was 2013, thank you very much. Yes, I was in the hotel for about 3 months because of an event at my house, a smoke event,
That was
as you guys might
2013.
remember.
And it wasn't the spare room.
Yes,
It wasn't the spare ribs, yeah.
yeah, yeah.
Yeah, I mean, the motor vehicle values have gone up pretty significantly, as well as the real estate values. I mean, it's just,
So are you seeing, that's both of you guys?
yeah, we're seeing it big in
So like,
Meriden.
I got a 2013 Altima.
Yeah.
Wait, when you get the.
Am I gonna pay, I'm gonna pay more
Yeah.
taxes because it's now
Well,
worth,
maybe not, because we're going down to 29 mils, but you may be paying the same at 29 mils that you paid at 33.
so all the used cars or all the Blue Book values
of
have
them.
shot through the roof, so
They have.
everybody's,
Yep.
last year I paid more than the previous year. My car is getting older,
Yeah.
but I'm paying more.
Violation. We got you, thank you.
Yeah,
So you,
they're up big. 15%, 20% on motor vehicles. We were in a
so be glad
revaluation.
you're the director of finance in Meriden and not the tax collector in
Exactly,
Meriden, right?
exactly.
Wow.
Well, we should at least give the people at home something about what we're talking about, right? So, John, the best thing probably
My
is
Cadillac might be $12 this year then.
grand list values, John, is that the one, or a mill rate calculation?
2000 or 1998.
No, you need your expense one.
Yeah, my 75, it's, I think I paid $10 or something.
Cost of paper.
Well, hey, Joe.
And it's worth more than my Nissan.
Joe,
Hey, Joe.
got some
See,
good news?
John, what I did is this, let me just show it to you. I told you I was doing this. See, I didn't have the non-revenue, right? But you had in this document here, right, showed me what these numbers were likely to be, right? This mill document, the PDF. This is before you sent me the mill, the Excel file. So I just transposed it, and I said, well, let me just think out loud here. If I have this much revenue from the grand list at the new grand list, and that was it, so that's our additional revenue. And whether I got it exactly right, it seems to be about the same, 3 million something. Then the car revenue, and that's where you have an increase. And then I just said the value of 1 mil. I divided it what you had on the sheet, right? You had it over here what the value of 1 mil was, right? And then what I said to myself was, okay, so potential mill rate reduction, no increase in cost, unrealistic, right, was 1.73, so that's a 5.21. So, like you, I said, what was our first, what I call first draft budget increase, right? Which was these are the numbers from the spreadsheet that you sent out the other day. You know the one I'm talking about?
No, you gotta show it to me.
Sure. This one.
Is that the expense summary?
Yeah.
No, you got the wrong number there.
Amount of change was 2.9.
What's that 3.8?
I don't know what it is. That's just a total. You have a lot of zeros in that column. John, it's the.
Oh, I know what that is. That's the final count.
Right.
Okay.
All it is, John, is the four major
from
things: the Amity,
Board of Ed,
the
yeah.
Board of Ed. It should have had.
You know what? Then I picked up the wrong number when I said I could get us even. I should have picked up the 2.9. I think I picked up the 3.8.
Okay. Well, this is.
That's even better.
even
You're right.
better.
It's even better. So I said, okay, now that's what I said, what if? We're not going to get there, Joe, but given you what you just said, but we'll see. I said, what if the increase was not 1.5 to us from Amity, it was 1? What if OBOE was not 850, it was 550? Now, again, I'm ballparking these. I'm saying, we took out $100.5 of various capital item, we put it in cap, all that. So that's why you have to have all the pieces to juggle. And maybe we can take 400 out of the town, again, for the same reason. This isn't going to change, so that's what got me down here. So the decrease was that. So what I was able to do was able to say, okay, if we hit these numbers of increase rather than those, then that would mean that we would have a what-if budget increase of that. So then I would kind of backed into, we can do the math, but the way I did the math, I could see there being a significant rate reduction in the mill. But all of that's dependent on, like Kevin said, you have to have all of these juggling at the same time.
Right. Fight where you land.
And we're not gonna get our way up in Woodbridge.
We were a little off. We were 0.41 to 399, so a little bit off.
So they're down to 399 from.
No, actually, no. So actually, their budget went, so we'll talk about it later. We'll get the
Okay.
end. Yeah, that's fine. I'll interrupt you now.
Well, we had a report with Jim already, so we'll add you
Well,
back.
but that was that.
Well, this is covered under general budget discussion anyway.
Yeah. So
Go ahead, Joe.
the budget was 4.92. Tonight, they came back to us.
Point that mic a little closer to you.
The budget was 4.92. They dropped it to 4.8%. We spent a lot of weekends and late nights dropping it to 4.8.
You spent that much time on that percentage, huh?
So we had a long discussion, and Chris Brow finally sees the light.
Not a 3.99.
No, but I mean the conversation. My conversation with them 2 weeks ago was, why don't we look at the areas from where the surpluses come? I said that.
Eureka!
Right. Been saying it, and now finally they started to finally understand. And it was amazing tonight. It was just, I was like, what's going on here? So our budget here, the medical and dental was 4.5 million.
Yeah.
I said, if we just cut that down to $4 million, everybody was like, looking at it, it's like, that makes a lot of sense. So I said, well, the surpluses last year was $1 million plus. This year, not as much because they're at 100%-ish. But, so and OPEB was up 267.
They
Cut
shouldn't
that
have-
back. Cut that back in half or 100 or whatever the
They
number
shouldn't have
is.
even had it. The market's
I
gone
know,
up like this,
I know.
and they're
Yeah.
putting money into open.
Yeah.
What
It
are
should
we
be
doing?
zero.
I know. So 267 is the number. Anyway, so we had a good conversation about, and I said special ed is where the surpluses come as well. And I don't know about where we are this year on track to the budget, but if you could save another,
And they're adding to that area.
yeah, they're adding staff, yeah.
And I get that
Yeah.
because it's cheaper than outsourcing.
Adding a
But if they're
cybersecurity
running
person.
surpluses in that account and now they're adding people,
Yeah.
they're just
That's
building,
big problem.
they're
Yeah,
adding
That's-
more.
That's
That's right.
irresponsible if that happens.
And they need to add a cybersecurity person to get this cybersecurity insurance, which is a new thing that's out
Oh,
there.
that's huge. We
Yeah,
know
it's a
that's
new-
gonna
it's a
kill us
new-
on our side too. Yeah,
it's a new
that's
thing,
important. But this equality person,
Yeah, that's the coach. The coach. Yeah.
that's
So that's
still in
on
the
there.
budget.
That's on the
They
list
give you a
too.
new deck, Joe?
No. All she gave us was just an update. No, nothing new.
Verbal?
Well, not this update. Just gave us a quick update.
So you have the
Did they
new
hand out a
number
sheet of
for
paper to
Orange?
you?
Yes. Right here. This is here. This is here. So for now, they made a motion to go to 3.99 down from 4.8. It passed 4-2. Sharon
On your
Huxley and
board.
On our board, yeah. So it was 399. It passed 4-2. Sharon Huxley from Bethany and I said no. And Matt had a long conversation. So Matt.
So you
proposed-
said no because you wanted to go down more.
Yeah, we're at 0.4.
Yeah.
we're at 0.4.
Yeah, well, we're
Yeah.
Thank you,
way
Joe.
off. So, and they keep, they saw me say 2% at our meeting, and they said it numerous times in the last couple of weeks, that they appreciated I was trying to go to 2. I said, well, 2 was real, but it's not even real.
Did they comment how I had a positive number?
So,
You're in the side room up there with probably a picture of me too, where they're throwing darts at it. all.
Joe, let me, what got passed? This to me is a 4.8, so
That-
So
you
you were
study
at-
it for a
Nothing got
month and a
passed.
half, and they come down from 4.92 to 4.8?
she
Is that
cut
what I'm hearing?
$60,000 off the budget. I'm like, really? That's what you can find?
Wait, 60,000?
Yeah, she cut
That's what this
60,000.
is.
60
You can do
grand.
that, we're rounding.
On 54 million.
Not bad, Kev. That's pretty good.
I would pay 25 grand to go up there, all right?
With a
And you
hatchet.
can give me 50% of what I find, and
Yeah,
I'll come
yeah,
out with
yeah.
6 digits in my
Yeah,
favor.
oh, yeah,
I mean,
easily.
this is,
Yeah.
you know, and it isn't like there's some magic.
How
to
do you
it.
cut $60,000?
It was nothing. It was IT contracts. It was just.
So,
it was,
Finance Committee 4-2, lower at the 399.
yeah,
Regular board,
is meeting the 14th. To discuss.
so the 60 that came out was only from the superintendent?
Yes.
Okay.
Okay, so we might have,
Okay.
the board has not acted on anything yet.
No, not yet.
Okay, good. So let me tell you what this is going to mean, team.
So they could probably find 600-700 very easily. I mean, I mentioned
Joe, I'm willing
today-
to go up there and do it.
I mean, I mentioned the medical and dental budget was 4.5. The actual was 3.6. Actually, the actual was 2.9. 2021. The budget for this year is 3.6. So we don't, they're right kind of on target for that. But that's $900,000 increase. I said just drop it to $4 million. We have our 22% reserve down from 25%, so
Yep.
that's still strong. So, and I said,
I mean,
OPEB was
it's really-
267, cut that in half. That's 600,000 right there without cutting a person.
And some of those people shouldn't be there.
They need
You
to
got
hire
the
two special
quality
ed people.
person. I agree with that.
Yeah, 1 and 1 they have on that. But the diversity, equality, I
Same
get it.
amount of
I get
guidance
it.
counselors they had 10 years ago when they had, 450
Yeah.
more students.
So
Although
Sharon,
she said my numbers were wrong.
You're wrong, you only have 9.
yeah, your numbers are wrong, Kevin.
So, I don't know. Well,
And Sharon Huxley went to the top line, which is 5.3 to all 3 towns. She wanted that to 4%. So we don't normally play with that because you have state grants and stuff. We really don't have control over that. But it's another $200,000. So I said, we'll cut 600. Because Matt figured it's about 420 for 0.81% drop, plus another 200. So it'll be about $600,000 of cuts, give or take.
Have you seen their projections on what they're going to receive in grants from the state?
They
Because
talked about it, yeah.
every
I know.
every municipality, every
I know.
district is getting
I
more
know, it's
money.
I know.
A lot more money in some cases.
Yeah.
So
So we don't know yet, Kev, but
you should ask for that
Well,
information.
I'll tell you what, Kevin, let me give you an idea of what this is going to mean. Unless you guys have a better way of doing it, I'm just going to take the 4.99, right? And I'm going to put 4.92. I'm just going to, just make believe it's there, okay? And then I'm going to say, okay, the difference is the difference, right? So we'll just subtract it. And then we'll say that, let's see, so 0.93 is our factor.
So Kev, the state grant line says $1 million budget 21-22,
Wait a minute.
and we're at 800 now, so we're off by 180.
So
Year to date.
orange.
So it's $1 million of state grants into the budget.
so with all this hard work, they saved the town of Orange 50%,
$30 grand.
$30,000.
Thank you very much.
It's not even worth
She came up
changing
there,
my
she was
number
talking about
until
it,
they
she
do
showed
the
the screen, it was 60 grand. I'm like,
It's not.
$60,000.
Surely not.
Really? And you're telling us that? And
Well,
it was contractual
We'll
savings and IT.
we'll just have to
it was
communicate
nothing.
it to our
was
town
just-
members, and if that's what they want,
Yeah, so.
Orange at 4.92 resulted in our having a increase of, Ajit, make sure you keep it fair here. All right, an increase of that, right? So, why don't we do it this way?
It's 30 grand.
Yeah.
If they cut it 60, we get half. It's 30.
No, but
He's looking at the overall, at
No, I'm
4.9
saying if it goes to
4.92
three,
increase.
if it goes to 399.
It's gonna cut us
In other
like-
words,
it's gonna
Kev,
cut us
if
like
it actually goes down
200
from
grand.
399 divided by 492, all right? And I don't know why that's doing what it's doing, but it's not happy. Okay, it's 81% of what it used
No,
to
that's
be.
not right. Is that right? 8? Oh, I see it. 8? Okay.
Yeah,
Oh, yes, okay.
1 out of
Yeah,
5
yeah,
would
yeah,
be
yeah,
20,
yeah.
right?
Well, it's
So that would say that if, this is going to be ballpark, but it's going to be pretty close, if not exact. All right, that this is there, and then we'd have that, and we subtract this one. I mean, that's the best I could do is 300
that
grand,
makes sense.
299.
Yeah.
Does that make sense?
Yeah.
If
Take
they
the-
do anything, but right now they're not doing that.
No, because we.
Oh, no,
ABOE.
but we have an
ABOE.
opportunity to, write letters, right? State our position.
I think ABOE will come down to 4%, I think. That's what it sounds like. That Chris Brown, the way he spoke tonight, I think he'll be able to get them to 399. It's it's pretty easy to do.
Still too high.
Joe, it
It's
should
still-
be
it's
way
still
less.
way
It's still
high.
too
We are
high,
fine with
but that's
4%?
easy to get to
Oh, we're not
399.
fine with 4%. Are you nuts?
We're not fine with 2%, but
And I said tonight, the
That's why we
surpluses
had-
come the last 3 months of the year, too. So we don't see them now. But historically, they've come the last 3-4 months, as we know.
and they've already took
And the budget's already in.
492,000
Yeah,
and put
yeah.
it in another account
They
already.
moved it out. You see, the new sheet in, they moved it back. The surplus came back out of the 1%. You see it? They moved it back down because they got killed on that one. Everybody hammered on that. Remember they moved it up to the line?
Yeah.
They-
Oh, they put it back?
They put it back.
Nothing behind the curtain here.
Because there's no vote. You can't just move a budget line without a vote.
Well, they've been doing that for a while.
Yeah.
They've been doing that
And
for a
Matt
while.
caught that too. Matt said, why did they do that? That it was not right. They took the money before it was even,
Well, they've been doing it for a while. When you do it so that the thing comes
They
down
expect
to zero,
Yeah, they
that's
expect
when you're just thumbing your nose at people.
Yeah,
I mean, that's what you got over there, the new administration.
John, is there anything else that's popped up? Or any changes on the other department budgets? We don't have, we're still in negotiation with the,
Oh, we won't have a contract settled with anybody
okay.
by then. I do have to make, I believe, a couple of adjustments on salaries where we have hired a couple of new people. We had to raise the rates. But I'll make those, $1 or $2 an hour, talking about $4,000 or $5,000. I'll make that adjustment.
So, John, the next meeting, in terms of the budget, we have OBOE, right?
Well, we have next Monday night,
Yes.
we have 6 o'clock here. We have to be out of here at 6:55. Have to be.
Well, I hope,
it should be quick,
Yeah.
right?
well, it's the audit report.
We got it,
It's the
one way
audit
or
report.
another. We have
Oh,
to,
it's the audit's done, we can't change it.
yeah.
Well, she goes through and explains things, but we don't want to get into minutia and all that
Yeah.
stuff, because we have to be out of here at 6:55.
And then I told Dr. Scarpetti, we'll start over there at 7:15. Originally, we said 7 o'clock, but it'll take more than 5 minutes to move from here to over there.
Let's just make it 6:45,
Get
Kevin.
up,
Let's shoot for
get
6:45.
up there.
And part of, a lot of that might be me, right?
Yes.
Kev, let's, Kev.
But we have a quorum, right?
Keeping it fair.
You're here, you're here. Okay, so, because
Yeah,
I know
I'll-
Kevin can't make it, so.
Now, do we want Michelle's on OGAT?
The audit report?
Yeah.
I'm
It's
up
been
for
in the
open
past.
government, but that's got to be the most, since there's nothing else on the agenda, it's just that.
All right.
I think it's a waste of the resources, and I don't know
Okay. So I'll tell-
anybody would want to watch that.
All right, so I'll tell Chris.
The audit report's,
Oh, no,
available
I
to
wanna
the
see it.
townspeople, but
I wanna
that,
see
to have
it.
that televised and
Okay.
waste resources.
Because at 7 o'clock, he's got 2 things again next week. He's got a zoning board of appeal meeting here.
Here.
And then one over there, the zoning board of appeal meeting, one will run live. Ours will be taped and then put up as, after he puts it on the schedule.
Now, that's our meeting over there, even though we're using their facilities, right?
Yes.
Okay.
I think
And-
it's probably a joint meeting. They probably file the agenda too,
Yeah, I'm sure. We'll have the whole Board of Ed there.
probably.
Okay.
I think so.
No?
I don't think
They attend, but they're not on the agenda.
Not on our
Yeah.
agenda, but they may file their own agenda.
'Cause there's a quorum.
Because they have a quorum there.
No, did I copy just John and Kevin when I sent a note to Dr. Scarpetti about the files we would want to have to be able to review them in advance of the meeting?
I didn't see
You
that.
didn't see that?
I didn't see it.
I'm not sure I saw it either, but I did talk to him today, and
I
he's
might not-
working
I
on
don't
it.
remember what I've done.
Guys. Sent items. Stuff with an attachment.
All right, so
I'll
then-
look for,
So as far as the budget's discussion section of this agenda, we're good with that right now? We'll move on. All right, so then on item 9, review revenue and cost reports. Is there anything of concern? I like how we got more pilot money.
Yeah,
Yeah, and that's even in there for the new year.
yep.
John and Kevin, yes. I see that this, so I need to forward that to, and that's on the 22nd.
And we have good tax collection. We're at 99%,
Already.
and we're $664,000 short of meeting our budget for the year, so pretty pleased with that.
Okay, let's stay with what John's doing.
Building permits, do we think we'll make that?
Usually you get a lot
Springtime,
of that
right?
in
Yeah,
springtime.
that's true.
That'll
Good.
start picking up next month.
Revenue report, here we are.
What's your collection rate in area, Kevin?
What's that?
What's your collection rate in area?
98.
That's fantastic.
Yeah, it's not bad for
Because New Haven was
city.
what, like low 80s a
Big
few
city?
years ago? And
Was it really?
Yeah. Yeah.
Yeah,
We shake them down, Meredith.
Wow.
Yeah.
Use your marshal, send them out there. Send Randy Thomas up there.
There you go.
John, what's the difference between motor vehicle and supplemental motor vehicle?
Supplemental are the bills that go out in December that are due January 1 for people that purchase new cars
After October.
What,
after October 1.
so the significance of having much more than we budgeted, any significance to that?
People bought cars and they're worth more money.
All right, thank you. Good.
Not a good time to buy a house or a car.
No.
Pool memberships, I would have thought they wouldn't be down. Apparently they are. That's on page 14.
The pool was closed for a while because of COVID, and then when they reopened without selling the memberships. They just charged them a fee when the residents went in. Small fee.
So lost
Okay.
revenue there.
All right. Significance of library fees being down so far?
Same thing, library was down, was
closed.
closed.
Okay.
And then they weren't charging for late books and all that.
That food service being only at 11% on page 5, the top of the
And I
page.
believe those bills go out to the restaurants in May and June.
Okay, that's all I have to.
Concerns on the expenditure side?
I'm trying to find the file here.
John, the only question I had was with, so there was a transfer for accrued sick leave, 153,000, and workers' comp premium of 190.
What page are you on?
It's on page 22 of the expenses. So it looks like we budgeted 130, and then we moved in
Is it employee benefits,
153.
Kev?
Yeah,
Yes.
Thank you.
Workman's comp.
accrued sick leave and workers'
The
comp premium.
190 is an encumbrance from a previous year.
Okay,
And the 367 is that 190 encumbrance plus the encumbrance I did for the year. I don't know why that 102 is showing negative there. I'll have to look at that.
okay.
What was the other one?
Accrued sick leave?
Accrued sick leave. Same thing there. The 153
Is it carryover?
is
encumbrance?
a carryover encumbrance. I've been trying to build up our accrued sick leave account because we
Yep.
have a couple of police officers, when they retire, they have
Yeah.
big money coming out.
Gotcha.
I don't know why that -5 is there. It must have something to do with the encumbrance or all.
Yeah, probably.
Yeah, because
Oh, you know what it is? We went over the current year budget, and it didn't go against the encumbrance. That's exactly
Yeah.
what it is.
Yeah.
Was it the same thing on the other area?
Yeah, it's the
Or
difference, Kev, between the
45, yeah.
130 in the first column
Yep.
and the 135 year-to-date.
Right,
It's 5, it's exactly that -5, 376 difference if you subtract those two, I think.
Subtract them out.
Yeah, pretty
One
sure.
of, one of the things, Kevin, we haven't figured out yet either is when we have an encumbrance on a payroll account,
Yeah.
how you get to take that encumbrance down as you're expending the payroll.
Hey, John, I have a question. Kevin, please exhaust yours.
Oh, I'm good. Yeah,
You
I'm
good?
good, yeah.
Back on page 4, and this led me to ask a different question, but back on page 4, when I looked at the 57,000, I was examining that. It's in the second column in the transfers adjustments in the equipment computer in the IT area. Are we good?
Yep.
Okay. So I didn't remember that.
That's the encumbrance from the previous year, 57,000.
So what that led me to do after I started seeing a bunch of these transfers, adjustments, and I'm saying, gee, I don't remember transferring, adjusting all this stuff. I went to the very back of the bus and said, oh, we've got $1,274,000 in this second column. All right?
Yeah.
And I was trying to understand, so just without giving me the doctoral thesis, give me the intro to 101 thesis of why there's such a large number in that column.
Those are all the encumbrances from previous years. The way this system works, as you do encumbrance, it comes into that line item in the new year budget to show you have that much.
So our budget is in fact the budget, the first column, the
Right.
76,114,029.
Right.
All of the things in the transfer adjustments are encumbrances, or do we?
I believe they are, because I don't believe we've taken anything out of fund balance and
I don't
added
remember
it
that either.
to the budget this year, so they are all encumbrances. And I know
Makes sense,
their
Kevin.
encumbrance on the audit is $2 million, so it's probably
Sorry, in
$1.3 million on the
ballpark.
town side and
Okay.
$700,000 on the Board of Ed side.
Yeah.
All right. Well, inquiring minds have to ask.
And some of it
Bottom-
was payroll related too, right? Because there was raises at the end of the year?
Yeah.
The town clerk, I couldn't understand with these PAs, there's 3 of them at the bottom. A quick education for Jim here.
That's money that we collect that we have to send back to the state.
Okay.
For every property sale, there's a fee that goes back to the state and some other fees that they collect. Dog licenses, marriage certificates, death certificates, there's a lot of different fees.
So if I'm on page 13, and I'm in roadway, and I see that the overtime budget is almost fully expended, how would I understand that?
13
It's
road.
25,000 in the middle of the page there, John. Page 13.
They've almost used up all of their overtime in that area.
Is that for paving?
No,
No?
that's just regular overtime. That could be for a number of things, going out for trees at night, working on Saturday or Sunday on trees. Could be a number of different things. Oh, they had the big
storm.
rainstorms
Yeah.
last August.
Oh, yeah.
and
Right.
September, where they worked overtime with cutting trees and all.
And you had the
And those
windstorm.
weren't
You had a couple
FEMA, yeah.
windstorms too.
Yeah,
Yeah.
I would expect them to probably run over on that account.
Okay. All right, I just
I think
noticed
they're,
it.
I think they're over
They're gonna
on
be, we
the
have another
snow
snowstorm.
also.
Yeah, well, yeah. Okay, Kevin, Kevin already, So when I go to page 23 then, John, in the same spirit of that second column, which must be an encumbrance, right? At the top of the page, how do we, just educate me on auto insurance encumbrance? I don't quite know what we're doing here.
Yeah, those have to be encumbrances again from the previous year. I'll probably wipe them out at the end of the year.
Okay. And again, this feels like I'm going to be educated one more time. The top of page 24, capital appropriations, 8.5 million. I somehow, the purchase of the Racebrook lands
That's
came
the
back into
land.
my head.
That's the land.
Okay.
John, I think this one was, did we take 25,000 on the fund balance for Pat?
No, I think I found a spot to take it out.
Okay.
Oh, I thought
I
that's
don't
what it-
remember where I took
Oh,
it
for the
from.
No,
Bicentennial?
How
Yeah.
about page 23, Kev? It's right there, I
Yeah,
thought.
it just popped into my head. I didn't know if that was moved from.
Bicentennial.
No,
Yeah.
I think I took it out of my workman's comp.
But John, how about then here's my question. Page 23, town services and other, special events, second from the bottom. I noticed that we put 25,000 in.
And I believe that was a transfer from another account.
Okay, but that's for the first down payment on the bicentennial?
Right.
Yeah. All right, good, thank you, John. Thank you, Kevin.
Anyone else? Okay,
Okay.
old business, tropical storm that I can't pronounce.
faces.
I'll get the file.
I gave
I'll get the
you-
file.
Now, I say it by now.
Right now, right?
John's got some of his pencil scratching on this one. I gotta
got-
learn what we got here, Johnny.
We got another $241,000 last week,
Wow.
so it brought us up to 279,561. I gave you that.
Yeah.
We're owed about another $4,000, and then that'll close it out. But I'm going to drop this off our agenda now for all
Yeah.
intents and purposes. We're done with that.
I don't know if we want this on OGAP, but I'll have to ask. Help me understand how we had invoices for 179, and we're picking up 279. Is this the labor involved?
The labor isn't here. If you
Yep.
remember, the labor went to the normal labor accounts.
Roger that. Thank you.
That's good.
Okay.
Okay, the second item is our annual audit review. We talked about that earlier. It's next Monday here at 6. John, Dr. Mohammed's coming on March 21st.
He wanted to come in April, but I told him he needs to come in March.
Yeah,
Because
'cause-
we don't usually have an April meeting. That's
No.
usually
I'm out of
our-
town that week up until I'll have to connect with you regarding the budget prep. I'm going to do it in March, the slide, so that we only have to do one night in prep. Oh, wait a minute, that's right after the 15th.
What's after the 15th?
Maybe I'll read it to you. Could I make a request? If Dr. Muhammad has materials, kind of like what happened tonight, but we recovered, right? Send us the materials. None of this last minute, here's 9 handouts that I want you to think. And, we do a quick read, we think we're communicating, that what didn't work at all, right? Here's our scope document from the CDC or something like this, and we're getting hit with it cold. We can't put it on the screen. No mas of that. Send it to you. If he needs help, I'd help, right? So that we can place it on the screen, we can have copies, we can come prepared, even if we're taking notes on it as we have it, right? So that's what we want to do with Muhammad. Before adjourn, Kevin, I need to send out to Kevin and Ajit, I'll make it to everybody. I doctored up the V2 of the OVO-NA document. I'll send that out. If you wish it, you can deep six it. And I'll also send out my slides, so all of you have a copy. I don't know if I could sneak this in the thing, but I'd like to tell you about it, Kevin. If you go up on the town website, if you go to boards and commissions, and if you go to,
Picture job, you said, right?
whoops,
We're doing that. After we adjourn, nobody can run out the door. We need to take a
Today?
picture.
Board of Finance.
Okay, good,
Because my hair and everything looks fantastic.
And go to Board of Finance, okay? What you find is you'll see the picture of not everybody who's now on the board, but and these can be editable by IT, by Paul. If you go there, and I have to review this with John, I promised John I would do this, so I have in each of the years, for example, here's 2023, I put some materials that we used in that meeting, okay? And when they were complex meetings, I would make subfolders over here. So here's all of 2021. All right, so what I'm doing is I'm taking basically what's on my PC, downsizing it, because you don't need all version 1, version 2, version 3, and all that stuff. And John and I were going to go through and we'll kind of decide. I think I've got a pretty good handle on it, but he has the ability to suggest edits for sure, and we'll work it out. But I wanted all of you to know that this material back to 2019 is all sitting there, okay? And obviously I have the originals and stuff. In the PowerPoint documents, I saved them as PDFs. So that's an update.
Great. Okay. Is there a motion to adjourn?
I'll make a motion to adjourn.
Second by Kevin. All those in favor?
Aye. Aye.
Opposed, abstained, meeting adjourned at 9:23.
All right.